scalp micropigmentation dots, which are very nicely put in the scarred areas, which give us a view that small hair follicle is coming out of it. After we do the scalp micropigmentation, we will tell you the length of the hair you have to keep at the donor area so that the result looks best. The ink which is used by the clinic should be a carbon-based ink so that whenever it gets fade, it fades to the shade of grey. It doesn't change its color because of sun or after a due course of time. Number 2 very important point is a term called failed SMP. We have had patients who got their SMP done at the donor area by some tattoo machine, putting some ugly looking, very thick, broad dots around their follicle and their scars. That looked even more uglier than the scars themselves. So what we had to do, we had to firstly remove those dots by the laser machine which we have, the Q-switch laser, and after 2 or 3 sessions of tattoo removal from their scalp, we had to do a fresh SMP with finer dots about the size of the follicles themselves, of the density which looks absolutely stunning, very nice, according to the distance between the follicles, the appearance of the dots looking just like the follicles. So always consider and talk with the clinic, the machine they are using, the ink they are using, and please ask for a few of their results if they have any. So you can even consider which of the methods, FUE or FUT, is better in terms of harvesting of the grafts. Let us now see before and after pictures of our patients who got this procedure done with us. You will also see a few videos of how we were doing it for them.